Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Now, erythrogenic toxin. Erythrogenic toxin is also called as streptococcal pyrogenic exotoxin. This erythrogenic toxin is also called as streptococcal pyrogenic exotoxin or SPE. This streptococcal pyrogenic exotoxin is of three types. We have type A, type B and type C. All these three, that is streptococcal erythrogenic exotoxins A, B, C, all these three are actually super antigens. So for all these three, we require among these three A, B, C, A and C are bacteriophage coded, whereas B is toxin which is chromosomal. So A and C are bacteriophage coded, whereas B is chromosomal. So this erythrogenic toxin can be identified by Dick test. What is this Dick test? Dick test is actually an intradermal test. So this is an intradermal test which produces erythema in susceptible individuals. So if you give an intradermal injection of this erythrogenic toxin, so in the Dick test we give intradermal injection of erythrogenic toxin, and when you give this you will see presence of erythema is seen whenever the individual is susceptible. Then second test we have is Skulls-Charlton test. In Skulls-Charlton test, you will see that if the patient has scarlet fever, this is mainly done for the patient of scarlet fever. In the patient of scarlet fever, if you give antibiotic injections, then actually in the scarlet fever, the child presents with rash. So immediately after giving antibodies, the rash will blanch. So this is diagnostic that the child is suffering from scarlet fever, and this test is called as Skulls-Charlton test reaction. And this Skulls-Charlton reaction is also due to this erythrogenic toxin.
thank you and thank you for watching.